Do you know that there are medications that can cause diabetes? Yes, diabetes is not a disease that normally develops in a vacuum. There are different things that can cause it. I'm Dr. Douglas Street, I'm a medical doctor, and I want to share with you some of the medications that can cause diabetes. Now, there are certain medications that increase the risk of developing diabetes or can worsen existing diabetes. Now, some of these medications are commonly used, and you may actually be taking one of them right now. So the thing is, there are times when even the doctor that prescribed the medication for you may not be aware that this medication can cause diabetes. You may be on medication for some other condition like hypertension, high cholesterol, and you develop diabetes, and you may have the impression that this is just a normal thing to happen. You may have it in your family, and therefore you have it, not realizing that one of the medications that you're taking may be contributing to the development of diabetes. So it's important for you to know what these medications are so that if this should happen to you, you know what to do. Well, the first on the list are steroids. Now, many persons, when they hear this term, they think of anabolic steroids, which are used for bodybuilding. But in medicine, there are a number of different steroids that can be used to help to suppress the immune system for different reasons. And these are the steroids that we're really referring to because they are very commonly used. They may be used for the treatment of allergic conditions such as asthma or allergic reactions, and they may be used in the form of tablets, syrups, and also in the inhaled form. The inhaled form don't usually cause it so much, it's more the tablet form or the liquid form that may cause this problem. So you have to be aware that this is possible and take the necessary steps to avoid it. It is also used in autoimmune conditions such as lupus and rheumatoid arthritis, and there are many other autoimmune conditions. And it also used in severe infections. It may be used in, for example, a person who is in hospital and they may be having a severe infection, and this infection may be causing a lot of inflammation, and that inflammation may be causing damage to your body. And the doctor may decide to add a steroid to the antibiotic so that it suppresses the immune system reaction so that it doesn't cause any further damage to your body. So that is another case in which it can be used. It may also be used in the treatment of cancers, and it may, for example, help to shrink the cancer, or it may help to avoid some of the effects that the cancer may have on you. So it may help in the treatment of cancer. Now, how do these medications increase the risk of diabetes? They may increase the production of glucose from your liver. The liver stores glucose, and what happens is that when you take these medications, it may increase the breakdown of the glucose in the storage form that is inside of your liver, and this can increase your blood sugar. Steroids also can reduce the effectiveness of the insulin that is in your body. And when you reduce the effectiveness of insulin, then the sugar may not go down as it should, and this may actually set you up for diabetes as well. Steroids are also well known to cause weight gain. So this, can cause diabetes as well. Now, these medications increase the risk of diabetes by up to 40 to 50%, which is quite significant. And some examples include prednisone, hydrocortisone, and dexamethasone. When you're on these medications, the doctor is usually aware that this is a possibility and usually take certain steps to limit the chance of this happening. For example, you may use the dose of steroid for a short time. You may use a low dose if you have to use it long term. Usually what we do is we try to keep the course as short as possible, so we may start off on a high dose and gradually taper it off until we bring it to a stop, or we may bring it down to the lowest level that controls that condition. So these are some ways which you can reduce the chance of this happening. The other very commonly used medication that can trigger the development of diabetes are the statins. And these statins include atorvastatin or Lipitor. You may also know simvastatin, which is another common one, and rosuvastatin. These are very commonly prescribed medications, and they may be used in case of high cholesterol. They may also be used in the case of reducing the risk of heart disease. So a person may have diabetes and hypertension, but they may not have a high cholesterol. But in order to reduce the risk of getting heart disease, doctor may put you on a cholesterol medication. They are also used in circulation medications. For example, this condition called peripheral artery disease. Even though you may not have high cholesterol medications may still be used. And this is because cholesterol medications also have an anti-inflammatory effect, and in that way it may help to improve your circulation. So how does it cause the development of diabetes? It may cause weight gain. It may again reduce the effectiveness of the insulin in your body, or it may increase the production of glucose in your body as well, just as what the steroids did. So these are the mechanisms. And statins may increase risk of diabetes by 9 to 12% in the general population, but in high-risk populations, it may increase it by as much as 20 to 30%. So if you have diabetes in your family, or if you have pre-diabetes, your chance of going into full diabetes is increased by 20 to 30%. This is something that you really have to be aware of, because oftentimes these diseases may run together. For example, these persons may have one condition, they may have hypertension, and then they may develop diabetes later, not realizing that it is some medication that they're taking that is causing the problem. So even though these diseases tend to run together, so a person with hypertension is more likely to have diabetes. Even though there's a connection between these illnesses, it doesn't mean that that's the reason why you got the diabetes. It may be one of the medications that you are taking. And then you have the antipsychotics. Some examples of antipsychotics are olanzapine, risperidone, quetiapine, and clozapine. Now, psychosis are illnesses such as schizophrenia that may cause you to lose touch with reality. So it may cause you to have hallucinations, it may cause you to have paranoid delusions, etc. These medications are very commonly used in these conditions. It's also used in mood disorders like depression, bipolar disorder, anxiety, and sleep disorders. So these conditions are not rare by any stretch of imagination, so it is not unusual for persons to use these medications in these conditions. These medications can cause diabetes by causing weight gain. It may reduce the effectiveness of insulin. It may also reduce the production of insulin from the pancreas and increase the glucose production from the liver. And it may even cause hormonal changes that may increase the risk of diabetes development. For example, cortisol. And we have discussed before that cortisol also can reduce the effectiveness of insulin in your body. These medications can increase the risk of diabetes by as much as 20 to 30%, which is quite significant. So if you're on any of these medications, be aware that diabetes may be a complication of you taking this medication. And then there are the antidepressants. And this is another set of commonly prescribed medications because depression is such a common illness. You have the selective serotonin reuptake inhibitors, or otherwise called the SSRIs, and these include medications like fluoxetine and also sertraline. They are used to treat illnesses like depression, anxiety, and even sexual dysfunction in men. You also have the tricyclic antidepressants like amitriptyline and imipramine, and these are used to treat depression, anxiety disorders, sleep disorder, and even chronic pain. There are some persons who have certain nerve illnesses that can cause significant pain, and these medications can be used in those cases as well. It also may be used in the case of bedwetting in children. For example, those persons who would have past the age that you'd normally expect to be experiencing bedwetting, they may be 8 years old or 9 years old and still experiencing bedwetting, the tricyclic antidepressants can be used in those children to help to improve on their situation. They increase the risk of diabetes by reducing the effectiveness of insulin, by causing weight gain, reducing the production of insulin, and increasing glucose production, and by causing hormonal changes. And as you can see, the risk of development of diabetes in the use of these medications is between 10 to 20%. And then you have the antihypertensives. Now, antihypertensives are very commonly prescribed because hypertension is one of the most chronic illnesses. And the medications that most likely cause development of diabetes are the beta blockers and the thiazide diuretics. Beta blockers are medications that slow the heart rate down and may also reduce the strength of the heart contractions. And some examples include metoprolol, propranolol, we also have bisoprolol and atenolol, and there are several others. They are used to treat hypertension, but may also be used to treat heart attacks, heart failure, abnormal heart rhythms, coronary artery disease, hypothyroidism, and migraines. And these medications can increase the risk of development of diabetes by between 10 to 15%. The thiazide diuretics are what we call the water tablets. One very popular one is hydrochlorothiazide. There are also others like chlorothalidone and indapamide. And these are used to treat hypertension, heart failure, fluid retention, and kidney stones. These medications, they can cause a number of metabolic problems, one of them being the increased risk of development of diabetes. And this risk can be increased by between 5 to 10%. Now, how do these medications cause diabetes? They may cause the depletion of certain electrolytes in the body, such as potassium and magnesium. Now, potassium and magnesium are important for the regulation of your blood sugar. So when these electrolytes are depleted, you might have an increased risk of development of diabetes. They also reduce the effectiveness of insulin that you already have and can increase the production of glucose. They also cause weight gain and may even reduce the production of insulin in your body. And these developments can lead to the development of diabetes. And then there are the hormonal medications, and these include birth controls and hormonal replacement therapy. Birth controls are used for contraception, of course, but they may also be used for cycle regulation. For example, a lady may be having irregular periods and they may want to have a more regular period, and birth controls may be used in this case. You may also be having severe menstrual symptoms such as bloating or severe dysmenorrhea or painful periods. It may be used to control the pain in persons who are suffering from that problem. It also may be used in polycystic ovarian syndrome because it helps to regulate the periods, and this is something that happens. They usually have irregular periods as well. It's also used to treat acne as well. There are some birth controls which are specifically used to treat acne. They may not be used for birth control purposes per se, but for the control of acne. Hormonal replacement therapy is often used for menstrual symptoms such as dryness, hot flashes, and mood swings, and they may also reduce the risk of development of osteoporosis, although this may not be a common reason for using them. Now, these medications increase the risk of the development of diabetes because they are steroids, and we have discussed before that steroids increase the risk of the development of diabetes. And then there are other medications. These medications may not be so frequently used, but it's important to know about them. The immunosuppressants like tacrolimus and cyclosporine, these are used in organ transplant. So in that population, it's important to know. And then you have antibiotics like rifampicin and isoniazid. These antibiotics are used for the treatment of tuberculosis. And you also have antivirals like efavirenz, which is used for treating HIV. There's theophylline, which is a treatment for asthma, not so commonly used these days, but still around. And then there's lithium, which is used for the treatment of bipolar disorder. Now, there are certain risk factors that may put you at a greater risk for the development of diabetes when you're on these medications. The higher the dose of the medication is the higher the risk of development of diabetes. Also, the longer you're taking the medication is the more likely that you develop diabetes. There may also be individual susceptibility factors, such as if you're obese or if you don't have a healthy lifestyle, not getting enough sleep, and so on. These may put you at even greater risk. Also, if you have a family history of diabetes, that may put you at greater risk as well. If you already have insulin resistance, then this may put you at more risk. And if you are older age, then this might also be a factor. Ethnicity may also be a factor. For example, those of us who are of African descent may be at a higher risk for development of diabetes. Now, if you're on these medications, it's important to take the necessary steps to reduce the chance of development of diabetes and also to find out if you're developing the condition. This you do by checking your blood sugar on a regular basis, also by monitoring for the signs of diabetes, such as increased thirst, excessive urination, and so on. You also want to maintain a healthy weight, because the higher up your weight goes, the greater the risk. You may also want to engage in regular physical activity, and you may also want to make changes to the medications, such as changing medication or reducing the dosage or shorten the course, etc. You may also want to make dietary adjustments, such as eating less sugary foods. And you may also want to take steps to reduce the severity of your condition. For example, if you're hypertensive, you'd want to make sure that you reduce inflammation by taking certain supplements, also by getting enough sleep, reducing your use of chemicals. These are the ways that can reduce the risk of, reduce the severity of the hypertension condition. As we close, we want to look at Matthew 7, verse 13 and 14. And it says, "Enter by the narrow gate. For wide is the gate and narrow is the way that leads to the destruction. There are many who go in by it. Because narrow is the gate and difficult is the way which leads to life, and there are many who find it." Now, whenever you're treating any medical condition, it's important to be willing to take the necessary steps to reduce the severity of these medical conditions. Many times persons may want to just go and use medications to control their illnesses, and this is the easy way of doing it. But these conditions, often you can treat them by using lifestyle and diet interventions. And many persons are not willing to make these changes. And of course, they may suffer from various complications. I want to encourage you to make those difficult choices, whether it is with your illness or with your life. Because it's the same way as how persons are not willing to make the necessary changes to bring about control of their medical condition, the same way they may not be willing to make the necessary changes in their lives that will allow them to enjoy spiritual maturity. So I want to encourage you to make a commitment to doing the right thing, because it works out better for you if you commit yourself to doing the right thing than just following the crowd and doing the things that you like. Thank you very much for watching this video, and I'll see you in the next video.